Now we are going to address some common barriers in feeding therapy. At times, as I'm sure you're aware, problem behaviors may arise during meal times. Some behaviors that you might see include the child does not assent or agree to participate, yelling, throwing items, spitting, elopement or escape, aggression, self-injurious behavior, and crying or tantrums. When the child exhibits these behaviors, you need to give minimal attention to the problem behavior and represent the demand. I will now demonstrate some examples of problem behaviors you might encounter and walk you through a step-by-step on how to address them.
Hi, Danny.
In this example, Daniela will not assent to participate in the intervention. For these scenarios, we represent the instructions and state the contingency again. So in this case, I tell her, if you touch the food, you can earn your Etch-a-Sketch. If a child once again does not assent, tell them that they can try again later. In this example, Daniela will begin to yell when asked to interact with the food. For these scenarios, we will ignore the problem behavior, which in this case is yelling, and we will represent the instructions.
You can touch the strawberry like this, Danny. Your turn. Good job touching the strawberry. You earned your Etch-a-Sketch. All right, Danny.
In this example, Daniela will begin to throw items after being asked to interact with the food. For these scenarios, we will ignore the problem behavior, which in this case is throwing, and represent the instructions. Daniela once again throws the food, so we will once again ignore the behavior and move on to the next trial.
Your turn. Try again. You can lick the cheese like this. Your turn. Okay.
In this example, Daniela will spit the food after interacting with it. For these scenarios, we will ignore the problem behavior, which in this case is spitting, and represent the instructions. In the second presentation of the instructions, Daniela tries to escape from the table. Gently redirect the child back to the table and restate what they can earn if they follow through with the instructions.
Your turn. All right, Daniela, try again. You can put the carrot in your mouth for 3 seconds. Let's go back to our seat. Remember, you can earn your Etch-a-Sketch.
In this example, Daniela will engage in self-injurious behavior when asked to interact with the food. For these scenarios, we immediately need to use a response block to block the child from hurting themselves. Once calm, represent the instructions. If the child does not comply and continues to hurt themselves, terminate session. The child's safety is our first priority.
Your turn. Let's have nice hands. Try again. Eat the chicken. Okay, show me your mouth. Awesome job eating the chicken. You earned your Etch-a-Sketch. All right, Danny.
In this last
Now we are
example,
going to
Daniela
touch
will
the
engage
food
in
again.
crying when
We have
asked to interact with the
tortillas,
food. For
carrots,
these scenarios, we will ignore the
strawberries,
problem
chicken,
behavior
and cheese.
and
Pick
immediately
one.
implement coping skills. In this case, I prompted the
Tortillas.
child to
Good.
take 3 deep breaths, modeling the procedure.
All right,
Once
you can
calm,
touch
we
the
can
tortilla
represent the
like
task.
this. Your turn. Okay. Let's try some breathing activity. Let's take 3 deep breaths. Look at Miss Bree. Let's take 3 deep breaths. Okay, we're going to do them together. We're going to take a deep breath in and out. And in and out. And in and out. Good job taking a deep breath. Now let's try this again. We're going to touch the tortilla like this. Your turn. Awesome job touching the tortilla. You earned your Etch-a-Sketch.